Today we're going to review over Pathology and Laboratory. Here is a listing of all of the subsections that you guys will see in the Pathology and Laboratory section. You'll come across the organ or disease-oriented panels, drug testing, therapeutic drug assays, evocative suppression testing, consultations, urinalysis, molecular pathology, chemistry, hematology and coagulation, immunology, transfusion medicine, microbiology, anatomic pathology, cytopathology, cytogenic studies, surgical pathology, transcutaneous procedures, other procedures, and reproductive medicine procedures. When coding for pathology and laboratory, you may have to code for the collection of the specimens separately. I have an example of 36415. This is to be used when you are coding for the collection of blood via venipuncture, okay? So it's taken by a needle. You would also code for the laboratory test as well, of course. When coding for organ or diseases-oriented panels, codes 80047 to 80076, these are basically a group of tests that are usually performed together or ordered together when they're done. So you would code from these panels when every single test in that panel is performed. If there's one test not performed in that panel, you will not code for that group of panels. So, for example, you will see your basic metabolic panel. If you will go to your CPT book and look at code 80047. If you look at 80047, you will see a listing of different tests being done. You'll see the calcium ionized, carbon dioxide, chloride, creatinine, glucose, potassium, sodium, urea nitrogen, I meant to say. All of those are listed within that panel. If one of those tests is not performed, you cannot code that panel. So if ionized calcium is not done, you cannot code for this panel 80047, okay? You may have to list these codes separately. It depends if there's a smaller panel with these, like the rest of the codes grouped together, or you may just have to list each one. So whenever you look at the panels, make sure that every single order was made for each and every test listed in that panel. Here is some more information in reference to what you need to do when coding for the panels. Again, make sure every single test is performed within that panel. Guys, if you look at code 80047 and 80048, those two are very similar. So if I was you, I would highlight the differences between the two. 80047 has a calcium ionized, whereas 80048 has a calcium total. So everything else is basically the same within those two panels. The calciums are just different. So make sure you pay attention to that. If all the tests are not performed in one of the panels, please do not feel like you can use Modifier 52 for reduced services. Modifier 52 cannot be used with these codes. You will just not be able to code from this list, okay? When coding for organ or disease-oriented panels, make sure you're paying attention to what's listed in each panel, because sometimes you may see two different panels written separately on an order. But then you may find that there's a combination of both of the panels in one panel. So you would just report that one panel. For instance, all the orders in 80051 is included in 80053. And all the orders that are in 80048 are also included in 80053. If you put those two panels together, 80051 and 80048, you will get 80053. So all you would need to do is report 80053. Let's talk about drug testing codes 80300 to 80304. There are two separate categories. You have presumptive, which is considered to be qualitative, what is present, like does the patient have any alcohol within their blood, okay? Definitive, quantitative, how much is present. Okay, yes, this patient has alcohol in their blood, but how much is in their blood? That would be the definitive part of it. When you're coding for these codes, you have to code for each specimen separately, by the way. So you're going to report each specimen. Okay, so if you have a blood specimen, if you have a urine specimen, you will code for each one. Therapeutic drug assays 80150 to 80299. These codes are based on, or these tests are based on quantitative, which is how much is present. There are some drugs that must be maintained at a therapeutic level to work properly. And then there's other drugs that if a patient is given too much of it, it can become very toxic and poison the patient, which most drugs can become toxic. These codes can be from any source, okay, but usually they're from the blood. These drugs are given for therapeutic purposes to the patient in the first place. They are listed based on generic names. And basically, if the measurements, what they do is they measure the specimen after the drug is given to the patient in intervals before the next dose to monitor the therapeutic drug for medication adjustment. If a drug is not found in this section, you guys will need to go to the chemistry section. If the drug is not found in the chemistry section, you will have to use code 80299. I have an example of a patient being given digoxin and being tested for a therapeutic range to make sure that the toxic level is not reached, so no side effects won't occur. So they're testing the patient for more than one reason. They could be testing the patient to adjust the dosage of the medication to make sure the patient is getting enough medicine for it to work properly, or they could be monitoring the patient to make sure the patient is not getting too much and it can become toxic to that patient. So that's what they're doing during these drug assays. Consultation codes 80500 to 80502. There is only two pathology consultation codes, and they're different from your evaluation and management codes consultations. These consultations are based on when a physician needs a second opinion from a pathologist. Okay, so they'll send the samples to the pathologist, and then the pathologist will look over it. Okay, in code 80500. Is basically used when the specimens are being reviewed. And 80502 is used when the clinical information is sent along with the specimen, and that includes the patient history, treatments, and other medical information that can be taken into consideration as part of the specimen that is submitted, okay, from the other pathologist or physician. If an E&M is performed along with this, you want to repeat the E&M only, report the E&M only. The consultation is requested by the attending physician. It requires an interpretive judgment of the pathologist. The test results of the test being reviewed must be out of the clinical normal range based on the patient's condition to even need this consultation. The consultation is rendered by a pathologist. Additional information about the specimen is reported, and a written report is provided. Okay, so you have different levels. Limited would be without review of a medical record, which is the 80500. And then you have the comprehensive, which is 80502, with review of medical record. During this consultation, the patient is not present. A lab test is, and so it's a specimen, and the slide is there. Okay, but the patient is not. Urinalysis codes 81000 to 81003. These codes are basically, they can be either simple or they can be complex. It'll be based on what is being done during the urinalysis. Let's start with the automated. These are considered to be more accurate than the non-automated. The dipstick is placed into a machine, and beams of light are used to analyze the different color changes during the time it's being examined. Patches on the dipstick will change color to indicate the presence of such things as white blood cells, protein, or glucose. A microscope may be used, and that's something you're going to have to pay attention to in the different descriptions in these codes in this section. Some of these codes include microscopic examination where other ones do not, okay? When a microscope is used, a urine sample is examined under a microscope, okay? Code 81002 is used when a physician is visiting a patient. I said a physician, I'm going to say a patient is visiting a physician, and actually urinate in a cup, and then they put the dipstick in, and then they look at the dipstick, and that's what that is. Manual, and it's without a scope. They're just basically looking at the dipstick. Then you have 81000, which is your common dipstick. And there are urinalysis codes for pregnancy, which is 81025. Okay. Molecular pathology codes. These codes in this section are basically used to examine nucleic acids to determine changes in genes that may indicate a germline. Okay, an example of that would be an inherited constitutional chromosome abnormality or somatic conditions such as a neoplasm. They may also be testing for histocompatibility antigens such as human leukocyte antigens, which is abbreviated as HLA. Okay, these tests are used in an area for developing an area of medical testing and finding clues to illnesses and their likelihood and possible future treatment. Okay, and that came directly out of your textbook. These codes are highly specialized. Okay, their analysis is based on or the use of genes. Codes in this section are typically based on specific gene types. They include analytical services performed in the test. Tier 1 gene-specific codes are 81161, 81200 to 81383. Tier 2, which are less common, are 81400 to 81408 and 81479. Multi-like assays with algorithmic analysis is actually found in a different grouping, but for whatever reason I put it on this slide. They're code 81500 to 81599. When coding for these, you may need to use a modifier 26 for the physician's interpretations for the report of these procedures. Your chemistry section, 82009 to 84999. The codes in this section are used to detect any substances in the body that includes like therapeutic or non-therapeutic drugs and or other substances. These codes are based on quantitative analysis unless it's specified otherwise. Testing for the materials may include your blood, your urine, breath, feces. Code samples from different sources are reported separately. Code samples are taken at different time of the day are reported separately. Most tests in this section are in alphabetic order. If a quantitative drug test for a therapeutic drug is performed and not listed here, you go to therapeutic drug assays. And then I have specific information. Code 82270 is reported once for the testing up to 3 separate specimens. Testing by column chromatography, codes 82542 to 85444 are used to describe quantitative and qualitative testing by spectrometry. Then you have 82803, that is used for arterial blood gas. 82951 is a glucose tolerance test. This is completed often during the surgery. During pregnancy. And what that means is a patient will, I'm sure you probably had this done, drink a sweet liquid, and then after the liquid is the patient drinks the liquid, the physician or the nurse will come in and take a blood sample. And what they're doing is they're testing for gestational diabetes at this time. Hematology and Coagulation codes 85002 to 85999. These codes are all about the blood, how it's clotting, how thick it is, what is the white blood count, red blood count, and so forth. These codes are divided based on the method of blood draw and the test being conducted. Platelet codes 85004 to 85049 is the complete blood count section. Components are separated. You have 85004. It's automated differential, which means the report will list all the different types of white blood cells. And you have 85027, does not separate all the different blood cells. The example of a test in this section would be the pulmonary embolisms and D-dimers. Immunology codes, the ones I have on the screen are codes 86000 to 86804. But this section is actually 86000 to 86849. These codes are based on the study of the immune system. Okay, codes in this section identify and quantify antigens, antibodies, and allergens. Okay. These codes in this section are in alphabetical order. Some of the tests include viruses, bacteria, and parasites. You have the qualitative or semi-qualitative codes, which are 86602 to 86804. An example of a single-step method or single-step method is the Regent strip, which is 86318. Multiple steps are taken during these tests. For some of them, you will code for the assay being performed. Okay. Transfusion medicine 86850 to 86999. Some of the most common reasons for blood transfusion would be to replace blood loss during an operation or after an accident, or if a patient is suffering from anemia. Okay. Transfusion medicine includes blood typing, type, and cross-processing and collection of material. The RH factor, which is a test that's done a lot during pregnancy, is found in this section. Do not use these codes for the actual transfusions. You will need to use the codes that are found in the cardiovascular section. Codes for this section are for the blood bank. Microbiology codes 87003 to 87999. The codes in this section, they are for bacteriology, which is the identification and study of bacteria, and mycology, which is the identification of fungi, parasitology, which is the identification and study of parasites, and virology, which is the identification of study of viruses. Okay. These codes in this section can be performed by one of two methods. You have presumptive or definitive method. Presumptive identification by colony morphology, whereas definitive identification requires additional tests. Some examples of tests that will be found in this section will include chlamydia, strep, and staphylococcus, etc. Okay. And then I have a note here for the code 87880. This is your strep test that's often performed in the physician's office when a patient is suffering from a sore throat. A lot of times they'll do that strep test. I've had it done myself. Codes in this section are similar to the ones that are in the immunology section. Codes 86000 to 86849. The only differences between these codes and those codes is the techniques that are being used. You need a code for additional studies. You may need to use Modified 59 if multiple specimens are taken. You will need to use Modified 91 if the same test is done in the same day, if necessary. Infectious agent detection. This technique is used and is important when coding these codes, and you will need to highlight the different techniques and group the codes alike that are similar. Okay. Coding for anatomic pathology and it's basically coding for autopsies. Cytopathology codes 88104 to 88199. These are used for the studies of cells for diseases. Sometimes they're referred to cytology reports. The way that they obtain these samples is by washing or brushing, smears, or fine needle aspiration. Surgical pathology codes 88300 to 88399. The specimen collected is collected during surgery. It has to be separated out and identifiable. It's divided into 2 levels of progressive complexity. You have your level 1, which is your gross examination only. You have your level 2 to level 6, which is gross and microscopic exam. These codes are based on what is being examined, like, for example, the breast, or the reason for the consultation. And in this sample, that will be, example will be the radical prostatectomy. That's the reason for the evaluation. You're going to report additional codes for special stains 88311 to 88399. Some of the most common modifiers in this section will be, which is the pathology section, modifier 90, 91, 92, and 99. Modifier 90 is for reference or outside laboratory built by the physician but performed by an outside laboratory. 91 is repeat clinical diagnostic lab test, same day, not used if due to an error, not used if there is a better code for the series of tests. Okay. Then you have 92, alternative laboratory platform testing, which includes portable test kit, single-use disposable chamber. Then you have 99, multiple modifiers. You're not going to use the modifier 51 with this section, okay, so do not apply a modifier 51. This concludes our review.